So that's for the active care bed, and that applies for all long-term care beds. So, once you get down to the, so for example, can you scroll down the page?
Yes, I know. It's always also too, one of the good things too is some you want to also too make sure you're getting a bed based on the what's going on with your loved one or with the patient, because two is that you may have, okay, what one person may need the other may not need. Right. So you may have a patient who may be okay with a long-term care bed, but then you may need have a patient that may need something more than a long-term care bed with this functionality. So that's really important to know too, because I think sometimes, and we have mentioned this before, that you'll get a bed and it may not have the rails, it may not have the bumpers, and things like that. If you have a fall risk, if the patient has rails on the bed, if they are their skin have sensitive skin, or they're trying to get out the bed, do you need bumpers, do you need the full rails, do you need the half rails? Those all of these questions that you should be asked, or to think about when you're ordering a bed or getting one, because what you don't want to do is get a bed and it has these fixed features when you could have got other additional features too that now you can't add to them.
Exactly.
Now you spend all this money for a bed that may not work in the long run.